Well, Dr. Sutton here answering a few questions for us. Look, we're all going out a little more, so still worth asking this question. Is it safe to dine indoors these days?
I think that question is dependent on your comfort with risk. When patients and friends ask me this, I say, ask yourself a couple of questions. But first, are you high risk? Are you vaccinated? Because if you're not, obviously you're at a higher risk. Do you have any medical conditions that increase your risk of infection? Like, are you immune compromised or taking immune suppressive medication? And have you had recent case of COVID-19? If you've recently been infected with COVID within the last 30 days, it is really rare to get reinfected. So I think you can be reassured that you have some level of additional protection. And then lastly, checking the rates of transmission around you, using those rates kind of like a weather report. You know, if it's raining or the cases are high, you're going to grab protection to protect yourself from the elements. And that's what I think about when I grab my mask. It's just an extra layer of protection just to protect myself from whatever's around me.
All right, just like an umbrella. I like that. All right, next question. I was recently diagnosed with TMJ. What are my treatment options?
Yeah, patients often call it TMJ. TMJ stands for the temporal mandibular joint, which is our jaw. And the most common problem is TMD, or temporal mandibular disorder. It can start with mild symptoms like jaw pain. Maybe sometimes you can have jaw locking or cracking. And sometimes that can progress to debilitating pain where patients need medical intervention. One of the tips that I have is when the symptoms are mild or moderate, you can just do some physical exercises at home. Hold your hand underneath your jaw tightly and just extend your jaw against your hand. And that kind of exercises your jaw and decreases your risk of TMD. Also, talking to your dentist. People who grind their teeth at night have increased risk of TMD. And then if needed, you can talk to your provider for medical interventions. And sometimes there are procedural interventions like injections.
All right. Thank you very much, Dr. Sutton. You can submit your questions to Dr. Sutton on his Instagram at dr.darien.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.